Hello everybody, this is Dr. Weaam Albanna Patient Information Leaflet YouTube channel. Today we will continue our journey about patient information leaflets. Our today's topic is Molar pregnancy and gestational trophoblastic disease. This information is for you if you have been diagnosed with molar pregnancy or another type of gestational trophoblastic disease. Molar pregnancy is one of a number of different conditions that are called gestational trophoblastic disease. These are rare conditions happen when a pregnancy doesn't develop normally from the very beginning. This information may also be helpful if you are a partner, relative, or friend of someone in this situation. The information here aims to help you better understand your health and your options for treatment and care. Your healthcare team is there to support you in making decisions that are right for you. They can help you by discussing your situation with you and answering your questions. Key points. Gestational trophoblastic disease is an uncommon group of conditions that include complete and partial mole pregnancies. Molar pregnancy is an abnormal form of pregnancy that can't develop into a healthy baby. Treatment of a molar pregnancy is usually a small operation to remove abnormal pregnancy tissue from your uterus, womb. Uncommonly, molar pregnancy tissue can persist after surgery, and you might need further treatment with chemotherapy. Gestational trophoblastic neoplasia is a rare form of cancer which includes invasive molar pregnancy. You will be followed up in a specialist center with expertise in the management of molar pregnancy and gestational trophoblastic disease. What is gestational trophoblastic disease? It's an uncommon group of conditions that happen when a pregnancy doesn't develop normally from the very beginning. Gestational trophoblastic disease includes complete molar pregnancy, partial molar pregnancy, and other much rarer conditions. For every 714 pregnancies which end with a live baby, there will be one pregnancy which develops gestational trophoblastic disease. What is a molar pregnancy? Molar pregnancy, also called hydatiform mole, is the most common type of gestational trophoblastic disease. In healthy pregnancies, a fetus develops when one sperm fertilizes one egg and chromosomes from each combine. The baby will have two sets of chromosomes, one from each partner. A molar pregnancy is abnormal from the very moment of conception because of an imbalance in the number of chromosomes supplied from the mother and the father. Molar pregnancies can develop into a healthy baby. There is nothing you can do to reduce your chance of developing a molar pregnancy. There are two types of molar pregnancy. Complete molar pregnancy. This usually happens when a single sperm fertilizes an empty egg, which has no genetic material inside. The sperm's chromosome double up to give the fertilized egg two sets of chromosomes, which have both come from the father. Complete moles can also occur when two sperm fertilize an empty egg. There is no sign of developing fetus in a complete molar pregnancy. The other type is partial molar pregnancy. This usually happens when two sperm fertilizes a normal egg, meaning the developing pregnancy has three sets of chromosomes, two from the father and one from the mother. In a partial mole, there are usually some early signs of development of a fetus, but this always abnormal and can't survive. Rarely, a molar pregnancy may develop in one of a set of twins. If you are suspected to have this rare type of pregnancy, you should be referred to a specialist center which has experience of this. Our question here is, when might a molar pregnancy be suspected? If you have a molar pregnancy, it's common to experience irregular or heavy vaginal bleeding in early pregnancy. You should be referred to an early pregnancy assessment unit for a transvaginal internal ultrasound scan. Molar pregnancy may show up on an ultrasound scan, but sometimes the scan only shows what looks like a miscarriage or an empty pregnancy sac. Molar pregnancy can be difficult to diagnose. If there is any doubt, you will be offered further scans and investigations. The levels of the pregnancy hormone human chorionic gonadotropin in your blood are much higher in a molar pregnancy than in a healthy pregnancy. You may be offered a blood test to check for this. Sometimes a molar pregnancy is only found when pregnancy tissue is sent to the laboratory after a miscarriage. Examining a pregnancy tissue in the lab is the only way to confirm the diagnosis of molar pregnancy. What happens if a molar pregnancy is suspected? The best treatment for a molar pregnancy is an operation to remove the pregnancy tissue from your uterus, as this is not a healthy pregnancy. This operation is usually done under general anesthetic and involve a small suction tube being passed through your vagina and your cervix, the neck of your womb, to remove the abnormal pregnancy tissue. This tissue will be sent to the lab to confirm the diagnosis of molar pregnancy. Why do I need to be sure if I have had a molar pregnancy? It's important to be sure if you have had a molar pregnancy, as there is a small risk that some of the abnormal pregnancy cells may develop into a more severe form of gestational trophoblastic disease. This may mean that you need further treatment. What follow-up will I have? In the UK, all women who have had a molar pregnancy are asked if their detail can be registered with a specialist center so that treatment can be coordinated and provided by experts in this field. These centers are at hospitals in London, Sheffield, and Dundee. Follow-up involves measuring the pregnancy hormone HCG either in your blood or your urine until it returns to normal. The specialist center will post you the kit that you need, and you will have your blood tests done at your GP surgery or local hospital. If you are asked to give a urine specimen, written information will be given on how to do this. If the level of human chorionic gonadotropin is falling in your blood or urine, it means the number of abnormal cells in the uterus is also falling, and you probably will not need any more treatment. How long you receive follow-up will depend on your individual situation and whether you have had a partial or complete molar pregnancy. Partial molar pregnancy are followed up until your human chorionic gonadotropin level is normal on 2 samples taken 4 weeks apart. Complete molar pregnancy are followed up for at least 6 months from the date you had your surgery, and for longer if your human chorionic gonadotropin levels are falling more slowly. Continuing with this specialist follow-up is important, as it's very successful in treating gestational trophoblastic disease, 98 to 100% cure rate, and there are very low rates of progression to more serious form of gestational trophoblastic disease. What is gestational trophoblastic neoplasia? It's a rare form of cancer. A molar pregnancy can be thought of as a precancerous illness, which can occasionally progress to gestational trophoblastic neoplasia. Gestational trophoblastic neoplasia usually happen when molar pregnancy cells keep growing in your uterus. It's usually diagnosed when your human chorionic gonadotropin level doesn't return to normal during follow-up. Gestational trophoblastic neoplasia can also happen after a miscarriage or the birth of a baby. This is much rarer than after a molar pregnancy, happening only once in every 50,000 babies born. Gestational trophoblastic neoplasia has an overall cure rate of close to 100%. What happens if I have gestational trophoblastic neoplasia? If you are diagnosed with this, you will usually need to have further treatment. This will be organized by specialist center that you have been registered with. Further treatments usually involve drugs, chemotherapy, although sometimes you may be offered a second operation to empty your uterus. Around 1 in 7 women who have had a complete mole and 1 to 2 in 200 women who have had a partial mole will need chemotherapy. This is usually straightforward with few side effects. The number and types of drugs used will depend on your age, type of pregnancy you have had, your blood human chorionic gonadotropin levels before treatment, and how long it has been since your pregnancy ended. Treatment is continued until 6 weeks after your human chorionic gonadotropin level have returned to normal. Surgery such as hysterectomy, removal of your uterus, may be recommended if you have one of the much less common types of gestational trophoblastic neoplasia. When can I get pregnant again? Having a molar pregnancy doesn't affect your chance of having another baby. However, after a molar pregnancy, you should avoid pregnancy until your follow-up program is complete. If you have chemotherapy for gestational trophoblastic neoplasia, your periods will usually stop during treatment. They nearly always restart within a few weeks to months after completing chemotherapy, and over 80% of women who have had chemotherapy for gestational trophoblastic neoplasia will have another pregnancy. If you needed high-dose chemotherapy, your fertility may not return after treatment. The need for high-dose chemotherapy is very rare. If you have had chemotherapy for gestational trophoblastic neoplasia, you are advised not to get pregnant for 12 months after your treatment is complete. Are there any long-term problems after treatment for gestational trophoblastic neoplasia? There is a chance your menopause may happen earlier than it would have normally, especially if you have needed more than one chemotherapy drug for treatment. It is safe to use hormone replacement therapy if needed once your human chorionic gonadotropin level has returned to normal. What contraception can I use during follow-up? Most methods of contraception are safe to use after treatment for gestational trophoblastic disease. They can be started straight after the pregnancy tissue has been removed. You shouldn't have an intrauterine contraceptive device, a copper coil or hormone coil IUS fitted until your human chorionic gonadotropin level has returned to normal, as it's more likely to cause a perforation in the uterus if it's put in too soon after treatment for a molar pregnancy. Your healthcare professional should discuss your options for contraception with you and answer any questions you may have. Will I have another molar pregnancy? The risk of a molar pregnancy happening again is low. For 99 out of 100 women, their next pregnancy will not be a molar pregnancy. Support after a molar pregnancy, gestational trophoblastic disease or neoplasia. Being diagnosed with gestational trophoblastic disease or neoplasia can be a frightening experience which may affect you physically and emotionally. You should be offered information and support about your diagnosis and throughout your treatment. There are specialist healthcare professionals available to support you at the Central Gestational Trophoblastic Disease Centers, and online support groups are available. About intimate examination. The nature of gynecological and obstetric care means that intimate examinations are often necessary. We understand that for some people, particularly those who may have an anxiety or who have experienced trauma, physical or sexual abuse, such examination can be very difficult. If you feel uncomfortable, anxious, or distressed at any time before, during, or after an examination, please let your healthcare professionals know. If you find this difficult to talk about, you may communicate your feelings in writing. Your healthcare professionals are there to help, and they can offer alternative options and support for you. Remember that you can always ask them to stop at any time and that you are entitled to ask for a chaperone to be present. You can also bring a friend or relative if you wish.